Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Treatment of asthma based on the severity of the symptoms. So before we move ahead, let's look at the short forms we'll be using, abbreviations. So the first one will be the SABA. So SABA stands for the short acting beta agonist. Then LABA is same, it is a long acting. LAMA means it is a long acting muscarinic antagonist. And the OCS means oral corticosteroids. HTM stands for the house dust mite. Next, very commonly used, the ICS. ICS stands for the inhaled corticosteroids. Then anti-IL4. IL4R, this is anti-interleukin 4 receptor. Interleukin 4 receptor. Then we look at IL5 as well as 5R. This is nothing but the interleukin 5 and the interleukin 5 receptor. Next is LTRA. LTRA stands for the leukotriene receptor antagonist. Then comes SLIT is sublingual immunotherapy. So all these are the abbreviations we'll be using. Now let's look at the management. Now we are moving to the management, and this is as per the GINA 2022. So to begin with, there is something known as a track 1. So this is mostly preferred. So in case the person it presents with the symptoms, so you have the symptoms for less than 4 to 5 days a week. So you're telling the symptoms persist for 4 to 5 days a week, less than 4 to 5 days a week. So how do you control this? So the control is by the as needed, and it is by the low dose. So it is by step 1-2, that is the low dose ICS formoterol. And next one, we move on to the symptoms. So how is the symptoms? The next one, where the symptoms, it shows that it is present most days, and waking up with asthma once a week or more. So waking up with asthma. So you're waking with asthma. So in such cases, you do a low dose maintenance. So there is low dose maintenance which is given, and there is also the ICS formoterol. The next one will be the daily symptoms or waking up with asthma once a week or more. So you wake up with asthma, that is once a week or more, and there is low lung function. There's presence of lung function which is very low. So what is the answer here? So here, how do you manage? There's a medium dose maintenance. So medium dose maintenance of ICS formoterol is used. ICS formoterol, this is used. Next, we move on to the persistent symptoms of exacerbations. So in terms of the persistent symptoms as well as exacerbations, and despite the adherence to the step 4. So here what is given is add on LAMA. So you add on the LAMA, that is a long acting muscarinic antagonist. So you add on LAMA and refer for the phenotypic assessment. So you do a phenotypic assessment. Then there is an anti-IgE anti-IgE, anti-IL-5, 5R, as well as the anti-IL-4R. Other thing to do is consider the high dose ICS LABA. So what you consider? You consider the high dose ICS LABA. Next, other thing is, this is by controllers. Now a reliever as needed, and this is by low dose ICS formoterol. So you do a low dose ICS formoterol. Now let's look at the alternate pathway. So in terms of the alternate path, here in case of the symptoms such as it's less than twice a month. So the controller here is step 1, that is take ICS whenever SABA is taken. So you take ICS whenever SABA is taken. The next step is where the other symptoms, that is twice a month. That is twice a month or more, but less than 4 to 5 days a week. Less than 4 to 5 days a week. So in this you give a low dose maintenance ICS. So what do? You do a low dose maintenance ICS. Next is when you move to the symptoms most of the days and you wake up with asthma once a week. So symptoms most of the days and waking. So you wake with asthma at least once a week or more, you can tell. So here the step 3, that is a low dose maintenance ICS. So you give ICS as well as LABA. LABA stands for long acting muscarinic antagonist. Then in terms of the daily symptoms, so here in daily symptoms, or you can tell in waking with asthma, or waking with asthma once a week. So you do it once a week, and also the decrease in the lung function. So in such cases, the step 4, that is the medium and high dose maintenance ICS LABA. So you do a medium or the high dose of the ICS LABA. Then in cases of persistent symptoms, so in terms of the persistent symptoms or exacerbations despite the adherence to step 4. So in such cases, you do a step 5, that is the add-on LAMA. So you add on LAMA. LAMA stands for long acting muscarinic antagonist. So you add on LAMA, then you refer for the phenotypic assessment. So phenotypic assessment is done, then positive, negative for the anti-IgE, there is anti-IL-5, 5R, as well as the anti-IL-4R. So you consider the high dose ICS LABA. So you consider high dose of ICS LABA. Now let's look at the reliever. So here the reliever will be as needed, that is a short acting B2 agonist. So let's look at the other controller options. So other controller options is, they can be the low dose. So in step 1, 2, there is low dose of ICS. So whenever SABA is taken. So whenever the SABA is taken. Or daily you do a LTRA. LTRA is a leukotriene receptor antagonist. Or you add a HTM SLIT. The HTM is a house dust mite, that is HTM, and HTM SLIT. Next, let's looking at the step 3, Here there is a medium dose ICS. So you do a medium dose of ICS, and you also add LTRA. So you add LTRA, and there is also the addition of HTM slit. So HTM slit is done. Next is we move on to the step 4. So in step 4 we add the LAMA. LAMA is the long acting muscarinic antagonist, or the LTRA, leukotriene receptor antagonist. Then there is the HTM slit. So then there is a HTM slit, and that is a house dust mite slit, or switch to the high dose ICS, or you switch to the high dose of ICS. Next is we move on to the step 5. So in case of step 5, what is seen? So in terms of S5, there is addition of azithromycin. So you add azithromycin. So azithromycin in terms of the adults, or you do the LTRA, that is a leukotriene receptor antagonist, and you add a low dose of OCS. So you add low dose of OCS is added, but you consider the side effects. To learn and grow daily like this, please do subscribe.